For this week's presentation, I have been assigned staffing and scheduling. In this presentation, we're going to learn the importance of scheduling and staffing properly, and how multiple systems are used to help encourage proper staffing, and how this will lead to job and patient satisfaction. First, we're going to talk about staffing. Staffing models are different everywhere you go. They can even differ from floor to floor in the hospital. Staffing is often determined by patient census. Patient census is always changing and changes from day to day and hour to hour. Most often, managers determine staffing by analyzing the average daily census, the level of care the patients need, and number of hours that patient care was provided. Next, patient classification systems are used. This system has the manager or facilitator evaluate workloads and staffing needs at the midpoint of each shift. This helps determine adequate staffing and even workloads for the next shift. This also allows time for staff to be called off or extra staff to be called in. Next, managers need to calculate the amount of full-time equivalents or FTEs that are necessary to adequately staff the unit. One person may make a full FTE, or multiple people may make a full FTE. These FTEs are determined by hours a week staff works, average daily census, and hours of care provided to the patients. Having the proper FTEs for a unit allows for adequate staffing to provide patient care. Next, we're going to talk about staffing mix. Depending on the time of day and the type of unit you work on, can determine what staff is needed. Staffing mix is what it sounds like. It is a mix of staff, whether it is RNs, LPNs, nursing aides, or patient care assistants. Using the staffing model determines how many persons are needed for each role. This specific model uses the patient's needs to determine staffing. If a patient needs to ambulate and bathe, it would be more beneficial to have more nursing aides and patient care assistants scheduled to work. If the patients need more education and discharge instructions, it may be beneficial to have more RNs on board. Next is block staffing. Block staffing is also another way that managers may determine their staffing needs. This allows for the same amount of nurses, aides, and assistants for each shift. This does not take into account the specific patient's needs to that shift. Regardless of the acuity or needs of the unit, they always have the same number of staffing. Emergency departments and labor and delivery units often use this staffing model, as you never know what is going to occur on these units. Lastly, managers often will have to change their staffing models based off the type of facility or a unit they work on. Critical care units may need more RNs present for critically ill patients who require more care. Medical and surgical units may need different amounts of nurses and aides based off the time of day, especially when physicians are rounding and patients are being bathed in the morning. Now I'm going to talk about staffing strategies. It's important to retain the staff that your current unit or organization has. Many people change paths in the nursing field. Studies have shown that more than 25% of new graduate nurses leave their first jobs within a year of employment. This causes for vacancies on that unit and in that organization. These vacancies are something that managers consistently have to pay attention to. Oftentimes, programs are initiated to help with nurse retention. One of these programs is the anti-bullying program. Nurses often leave due to bullying and harassment, whether it's from their peers or from physicians. This leads to stress and job dissatisfaction, and in turn encourages nurses to leave. Because of this, other programs are put in place to decrease bullying in the workplace. For instance, most hospitals have adopted an anonymous bullying hotline. Next is transition to practice programs. Transition to practice programs have been put in place to help decrease new graduate turnover. This program helps the new nurses build relationships, gain confidence, and increase commitment to an organization. Factors that affect staffing. It often feels as though we don't have adequate staffing. However, life happens outside of work and people and their children get sick. Because of this, staff will need to call off of their shift. This affects staffing models because they will then have one lesser nurse or aide. Hospital units will often ask others to pick up a shift when this occurs so that they still have proper staffing for that shift. Next is maternity leave or medical leave. If someone leaves on maternity or medical leave for a set amount of time, this can affect staffing as well. This is when situations can get a little sticky. You know these staff members will be back in a couple weeks or months, but what do you do until then? Most managers will not hire someone for this small amount of time, but may utilize PRN staff. Next are vacancies. There are many opportunities within the nursing world. This allows for people to constantly move around with new career opportunities. With this being said, this can cause vacancies. Vacancies seem to be a real issue as there is still a nursing shortage. Units can often not keep up with the staffing cycles. When someone leaves for another job, they don't have someone to replace that person immediately, allowing that vacancy to be open for quite some time. Staffing and scheduling the appropriate staff is also an area of concern. You cannot schedule all the experienced nurses one night and the newer nurses the other night. Managers then have to ensure that there is a proper staffing mix on each shift. Next, we're going to talk about scheduling. Scheduling has a significant impact on staffing. Different units may use different scheduling models. The first model is self-scheduling. This is when the staff signs up for preferred hours to work. After staff signs up, the nurse manager needs to review to ensure that there is a good balance between experienced staff and newer staff. The manager also needs to ensure that there is adequate numbers of staffing each day. With that being said, the schedule can change and the hours you sign up for may also change. Next, you have automated scheduling. Automated scheduling is another form of scheduling used that is supposed to be more fair. It automatically signs up staff for when there are staffing needs and when patient care is increased. This automatically picks a staff member during a scheduled period, and it is then considered to be more fair. Shared scheduling is next. Shared scheduling is also used. This is when two persons share a full-time schedule. For example, for a 12-hour shift, one person may work 6 hours and the other will work the remaining 6 hours. This is convenient for those with young children or those that are nearing the retirement age. Next is open shift management. Open shift management is also a scheduling process that managers will use. This is basically overtime. This shows open shifts that are available that you can work in addition to your expected shifts. However, the majority of the time, this overtime needs to be approved by your manager. Most managers willingly approve the overtime, however, may get backlash from some of the higher-ups. Flexible staffing pattern is also an option to help cover open shifts and vacancies. Staff may work a wide variety of shift hours ranging from 4 hours to 12 hours. However, shorter shifts may disrupt continuity of care as the caregivers are constantly changing. Lastly is supplementing staff. Supplementing staff may help decrease vacancies and decrease critical holes. PRN staff may be used here along with internal float pool if available or an outside agency. However, this may cause for some resentment from current staff as the person who is filling in may make 2 to 3 times more than what the current staff is making. Effects on nurses and patients. If there is adequate staffing, then the nurse-to-patient ratio should be decreased. If you have decreased nurse-to-patient ratios, nurses have better rates of job satisfaction. This in turn affects patient satisfaction. If a nurse is able to spend more time with the patient and provide the best care possible, patient satisfaction scores increase. Nurses also have increased satisfaction when they self-schedule. This gives them a sense of feeling of in control of their work schedule and their outside of hospital schedule. Nurses and nursing staff are part of a patient's admission until discharge from the hospital. Appropriate staffing allows for decreased mortality rates, decreased rates of falls and infections, and decreased length of stay. However, understaffing has shown to be the greatest threat to patient safety and patient outcomes. It is important to have optimal staffing so that you decrease the ratio of nurse to patients and provide the greatest care that you can so that you're not putting your patient's safety at risk. Now we're going to watch this video. This video talks about how much easier scheduling is with the self-scheduling and open shift management system. It shows that the nurses are feeling more satisfied and have more say in their schedule. So let's just take a peek at this.
St. Rita's has been using the Open Shift Management since November of 2007, and we started the scheduling system in February of 2010. We have 425 beds. We are a level 2 trauma center, and we have 22 off-site locations. The staff did not have any access to their schedules until the schedule was put out.
We would have just a pad and paper, just a blank calendar. Everybody would fill in. And sometimes, you only need 8 on a day and you have 10 on a day. And then the manager would have to go through and ask people to move, switch them over, then put it in.
It has helped clean up the balancing process because they can see if only 5 RNs are needed and all 5 have bid on that day already, they obviously have to pick up another day that week.
You don't have to spend as much time thinking up somebody's schedule rather than them just putting it in, and then we can go back and adjust the schedule as needed.
I like the availability and the flexibility of my being able to access it from home. I like the availability of being able to identify what sort of extra shifts might be available for me to pick up.
It takes the responsibility off of us and puts it more on employees themselves.
I've had people that are on vacations, and they will use it when they're on vacation to self-schedule or to bid on open shifts.
I just thought that was a neat little video that shows the changes of just going from paper scheduling to computer scheduling. Next, this is a chart. This chart is from API Healthcare, and it shows that staff satisfaction has the greatest impact on patient satisfaction. The close second is ensuring there's a proper staffing mix. Like previously mentioned, it is essential to ensure that there's a wide variety of experience working during each and every shift. This way, one shift is not more lopsided than the other, and that better care isn't being provided on one shift compared to the other. It also shows that patient satisfaction was also impacted by the staffing needed based on patient acuity. In summary, there are many different staffing strategies and scheduling options to help enable nurse retention and utilize the best plan for staffing to enable increased patient outcomes. Managers are continuously analyzing ways to make staffing and scheduling better. Multiple strategies can be used together, however, there is not a perfect solution to staffing and scheduling. Nurse and nursing staff retention is essential. Programs have been developed to ensure that new graduate nurses feel as though that they are part of an organization and help decrease any bullying they may experience. This in turn increases the chances of retaining experienced nurses. If there is proper staffing for each shift, nurses and nursing staff have job satisfaction. This in turn allows for patient satisfaction and better patient outcomes. And those are my references. I hope you guys enjoyed the presentation.